Hey everybody, welcome. Gonna wait just another minute or two to let people continue to join, but I will go ahead and introduce myself. My name is Harper Byers and I work for the School-Based Health Alliance. I am so excited to welcome you to our Be the Change session, utilizing social media to effectively increase community involvement and accessing SBHCs. If you're able to, we would love if you could turn your cameras on and join us, but know that it is not required. And with that, I will pass it over to our lovely presenters to get us started.
Hello, everyone. My name is Liliana, and I have a little bit of an intro slide to do a little bit farther in the presentation.
Hi, and I'm Lorena. I'm Liliana's sister, and I will also be presenting.
So if you guys notice, we have just a little something to do before we get started. We want to know a little bit about you guys. So how we can kind of structure this presentation towards you guys. So if you could put what state you're from, your grade level, and your favorite social media platform in the chat for us, please. Also, at the end of our presentation, we're gonna have an activity which will need the Goose Chase app. Does anyone not have a cell phone? And actually, I can't see anyone. Lorena, did anyone raise their hand?
Just Marisa.
Oh, okay. That's fine. Awesome. So I'm seeing some in the chat. How many people do we have?
I think we've got 7 or 8 of us total.
Awesome. Yay, I'm so excited. I'm so glad you guys are here. All right, well, we can get started. Go ahead and keep putting stuff in the chat and let me know if you have any questions downloading Goose Chase. It should be free and you should be able to log in as a guest. So basically, welcome everyone. We are, the topic of our presentation today is utilizing social media to effectively increase community involvement and accessibility to SBHCs. And so basically what we're going to be talking about is our own experience utilizing social media. Just so you guys know, we're not experts. We're really just going to try and tell you about our experiences that we had, Lorena and I, as we were making our video about SBHCs in our community. So I did want to start with a little Kahoot icebreaker. So let me go ahead and get that up. All right. Has anyone not played Kahoot before and needs any instructions? Basically, you just go to kahoot.it and type in the game pin.
I think
Lorena,
that's
you're gonna, it's everyone? Okay. Awesome. Let's get started. All right. So this is just basic information about social media. We just got some fun facts. Would be a good way to start. Just curious, can you guys hear the Kahoot music?
No.
Oh, I don't know how to share it. Sorry. I guess I'll just listen to it myself. So social media. So this one, I think is kind of surprising to a lot of people that most people have about 8 accounts on social media. Let's see. All right, Marisa. All right, so this was a trick question. All of them are used for social media. Nice, Chris. All right, so, oh, no one guessed it. So 25 to 34. All right,
That's kind of surprising. I was surprised when I saw that.
for sure. Yes, it is true. Facebook is the number one. Definitely not among teens. I think that's what tripped us up. Teens are used Facebook. All right, okay. Any more questions? Yes, nice. You guys did well on this one. All right, and I think we have one more question. Nice. Yes, Snapchat is more popular among teens than TikTok. All right. So that was fun. Let's go on to the actual presentation. Do you have anything to say, Lorena?
No,
Okay.
some fun statistics though.
Wait, sorry, did someone say something?
No.
Oh, okay. I can't see anyone. I'm really sad about that. Okay. So, Lorena, do you want to introduce this?
Sure. So basically just what we're going to be talking about today is the steps that we took in the production of our video and how we distributed it. And we're going to pinpoint some objectives and talk about promoting on social media.
Hi, I'm Liliana. I am from Albuquerque, New Mexico, and I attended Albuquerque High School. I graduated this past summer, so I am now attending Occidental College. I'm studying pre-med. I am an advocate for equitable healthcare, and so a lot of these clubs that I've listed here are some of the things that I've done in order to help equitable healthcare in my community. So PAUSE, which we'll definitely talk about more in the presentation. It stands for Peers of AHS, which is Albuquerque High School, Understanding Student Experiences. And we're basically a peer-led group that looks at some of the health-related issues at our school, and then we strive to find solutions and to educate our peers about them. I'm also part of DSHAC, which is our District School Health and Advisory Council. And with that, we look at the health-related problems throughout the district. And the same kind of thing as we look at the problems and we try to find solutions to them. I've also worked with New Mexico Appleseed, where we were working together to to help educate homeless children throughout the pandemic. And that was something that I really worked with social media a lot to reach out to a lot of those kids. And I've also partnered with Breaking the Silence New Mexico, which is to break the stigma of mental health.
So I'm Lorena. I am also from Albuquerque, and I am going to be a junior this year at Albuquerque High School. And I'm also a member of PAWS. And as Leanna said, we'll get into that more later in the presentation. Also Dream Makers, which is another health-related program at our local college. Peer Helpers and Breaking the Silence, as Leanna said.
So how did we get involved? You know, two students who really had no experience with social media. How did we get this to be in charge of this project? So Albuquerque Public Schools is our school district. And I was talking about DSHAC, how we look at some of the issues. And DSHAC at one of their meetings, it was right after the pandemic hit, they noticed a decrease in student usage of the school-based health centers. And so they reached out to PAWS, which is our group at AHS, and they asked for suggestions on how we could get more students to go and utilize the services at the school-based health centers.
So during our PAWS meetings, Liliana came up and asked anyone if they would like to be a part of the video, and we had some volunteers. And we also tried to get some people from other schools, but Liliana will explain how that happened later.
Okay, so we're just gonna break down kind of the steps of what we did to produce our video. So it was really important that we make it a group effort. And so for me, I was chosen as the leader of this video, but there's no way I could do it all by myself. So I reached out to, of course, the school-based health centers. I met with them and asked them what they thought the most important services were to bring to students' attentions. I reached out to my administration at school, but as well as administration at high schools throughout the district. I also worked with my fellow students, teachers, and alumni from our district.
So because it was online and during the pandemic, it was kind of difficult to get together a video. So we had to record each in our own homes on our own. And so we got actually a professional videographer to teach us how to record on our homes, what's the best way to record, what's the best place to be. He would recommend like being in a closet because it has the best sound or whatever. So yeah, just being online, and it was important that we understood how to do it in our own environment.
So when we were working on our video, we brainstormed a lot of ways to make this information accessible. And so we found that videos are a lot more engaging when students see other students, their peers, especially when it's to say their personal experiences with the school-based health center. And so we really wanted to utilize that a lot. We wanted the students to be the main face of the video, and we wanted students to feel like the school-based health centers were for them, because that's really who they're for.
So we also created a script that we just put it on a Google Doc and said anyone can access it and contribute what they would like. And we also created a slides presentation that would be our informational slides. And so we also did that on a shared document. But that was honestly kind of difficult because everyone had their own idea of what design they wanted to do. So we had some problems with consistency, but eventually it worked out. And yeah, like I said, due to the pandemic, we were all on our own in our own homes. So we had to learn how to film on our own, just with our phones, and then send in the videos to be edited later.
So we were really lucky in the fact about editing our videos that APS had a professional videographer. And since we worked really closely with them, they were able to give us that videographer to actually put all of our videos together. So really, we just kind of had to send him that storyboard. And I remember having a lot of meetings with him and saying, this is what I want to be in this video. You know, this is kind of my vision and what I wanted to look like. And he was really great at putting that together and everything. We also, like Lorena was saying before, we made the information slide. So it was our own project, but we still had that help where he was able to put it together for us. So, So steps taken in production and distribution of our video continued. We had to do a lot of research. And so I remember going to lots of virtual meetings with lots of adults. That was honestly really stressful. It's kind of hard sometimes as a student to get adults to listen to you. Um, but you just kind of had to show up at every meeting and had to say your thoughts and not be afraid to make a stand, and say what you think. And so I showed up at a lot of meetings. And I also scheduled a lot of my own meetings. That was sometimes hard as an organizer, scheduling my own meetings and then only Lorena would show up, which definitely happens sometimes. So you have to be kind of flexible and be willing to send out emails, lots and lots of emails for people who miss the meetings. But in the end, it all worked out. And so also another thing that I had to do was put together a Google folder with all of the information so that everyone was able to access it. And that just made everything so much easier. They could send their videos to that folder. They could look at video tips in that folder. And honestly, it just made life so much easier for me and everyone else.
So after we had completed the filming of our video, we asked everyone in pause and a lot of other different people for feedback so we could improve upon it, and make sure that we got that youth voice before it went out to everyone. So yeah. And when it was time to distribute, after all the editing was done, we worked with schools in our district and our advisories and senates, and student leadership in all of those schools to post videos on their social media. And then also we worked with our school district, their YouTube channel, and we also posted it on there. So we had a lot of different organizers who were sharing our video.
And something we really wanted to do was post on multiple platforms. That way we could reach as many people as possible. I think in our video, we fell a little short on that. We could have definitely done better. But kind of what we did is we had our main video on YouTube, because YouTube, it's very easy to share that link on different social media platforms. So we had it on our YouTube, and then we had our pause and our Senate post on our Instagrams. And then everyone involved posted on their story just to reach out to as many students as possible.
Where can I go to get an updated sports physical?
Okay. This is the video. Yeah, we're gonna watch it right now just so you guys can see the video that we're talking about. And then part of something that we really wanted to do was have a critique. Lorena and I have seen this video so many times, and we understand that it is not the best video, that there's definitely some good points, but feel free to really digest it and critique our video. So yes. And let me know if you can't hear it, but I think you should be able to.
How can I get up to date on my immunizations?
I need to get an STI test or treatment. Is there a place I can go without needing parent permission? Can I get mental health support at the same place?
What if I just need an annual checkup?
The School-Based Health Center.
What is a school-based health center? A doctor's office for students right here at an APS school.
A safe place for students to get free health-related services.
Essentially a doctor's office that's located in a school so that students will have easy access to get help for medical, behavioral health, or case management needs.
Everything about our medical clinic is exactly the same as you would find at, your regular doctor's office.
What services are available? One of the services available is behavioral health. Behavioral health includes screening and care for emotional well-being.
It can include therapy, psychiatry, substance abuse, eating disorders, and other referrals are available when needed.
Behavioral health is emotional support offered through therapy or counseling sessions.
It may be something relatively simple like a couple sessions with a therapist to learn some skills, better ways to cope, or help with a breakup or some friend drama. Or sometimes it's something a bit bigger, and maybe medications are needed to provide some support. We offer that full range of services.
Medical care is offered at the student-based health centers. Medical care includes wellness exams, sports physicals, injury care, illness care, and immunizations and vaccines.
The students that do come in and see us tend to get really good full-service help.
I'm a senior at Albuquerque High School, and for the past 4 years, I've taken advantage of the school-based health center to get an updated sports physical. It's super easy and convenient. I'm able to get my physical on the same day as registration, and it's a big relief to not have to schedule a doctor's appointment.
School-based health centers also provide sexual and reproductive health services.
In the state of New Mexico, there's a law that comes into play when students reach the age of 14, and it's called the Children's Code. And it says that students can access their own confidential services at the age of 14 without informing the parents.
It allows you to seek care of your own volition without anybody else knowing for mental health services, so things like counseling, for substance abuse, things like testing and treatment for sexually transmitted infections, education and help preventing sexually transmitted infections. We can provide medication for these things like birth control pills, condoms, arm implants, Depo-Provera shots. Sometimes people just want information.
Hello, here is a little bit of my experience as a young person accessing an SBHC. I went initially because I wanted to receive confidential reproductive health care because I was on my parents' health insurance and could not access it confidentially. Initially, when I met with my provider, I wasn't particularly honest. I went in to get what I needed and leave, but then as I became more comfortable, he was able to provide me with more sex education, with making safer choices. He was probably one of the first adults to really talk to me about consent and the nuances there. So of course, as someone who didn't receive sex education, like, this was just amazing that I had the opportunity to have those conversations with someone and feel safe in doing so, like really asking questions.
Many school student-based health centers provide case management for students.
A case manager helps a student access or connect with resources in the community.
Really kind of meeting that student where they're at, hearing their needs, and then pulling in all the community resources to help get them what they need. So our case managers are really great at filling in all of those gaps for us, things that aren't quite medical but aren't quite behavioral health or mental health.
Dental care is also available at select sites. Those sites include East San Jose Elementary, Van Buren Middle School, and Highland High School.
Dental services include sealants, cleaning, and fluoride.
Who can go to a student-based health center?
School-based health centers are available to all Albuquerque public and charter school students, even if you are over 18. School-based health centers only see students.
Please note that you can only visit school-based health centers based on grade level. For example, high school students can visit a high school site, but not any middle school or elementary school-based health centers.
Middle school students can visit other middle school sites, but elementary school students should only visit elementary schools.
Here's a list of all the middle and high school locations in Albuquerque. Please keep in mind that some of the services are different for different locations. To see the services for each location, visit the school-based health center website or call the individual school-based health center.
How do I access the school-based health center?
To access the student-based health center, call their phone number to set up an appointment. Some locations are doing face-to-face appointments, and others are only doing telehealth for medical and behavioral health.
You can view which schools are doing in-person visits on their school-based health center website.
Telehealth is an appointment that is conducted virtually by Zoom or telephone so that the student does not have to come in for an appointment unless it's necessary. Telehealth is what we're using right now during the pandemic for a lot of our appointments.
It is a really nice option if transportation is challenging or if you just feel more comfortable staying at home, but it still gives you access to all of the same services through the school-based health center that you would otherwise have, medical, behavioral health, or case management.
The Albuquerque school-based health centers are not doing COVID-19 testing or treatment. If you or someone you know needs to be tested, please visit the NMDOH site for more information at cv.nmhealth.org.
Always remember to wear a mask, get your flu shots, and wash your hands often.
It is so important during this time that you protect yourselves and those around you to stop the spread of the virus.
You will need to check your location's website to see if they require an online pre-screen for in-person visits. If you have an in-person appointment, you will be required to wear a mask, and all of the staff will be wearing protective gear. If you are not comfortable going to the school-based health center, remember that there is always the option of telehealth.
All right. So,
Where can I go to get an updated sport?
sorry. Don't want to watch that again. Um, so I do want this to be kind of like a discussion. I want to hear from you guys in the audience that we're presenting to, what you guys kind of thought were good initially seeing the video. And you can put in the chat or go ahead and unmute, whatever you feel comfortable with.
I felt like it was extremely like comprehensive. Um, as like things were being said, I found myself like having a question, and then like 30 seconds later, that question was answered in the video. So that was really helpful.
Yes, great. Thank you. And then in the chat, I like that we had providers involved getting a summary of their services. Yes, I think for us, some of it is important to be given by adults. Some of the little nuances, like the New Mexico law that we mentioned, I would be a little bit better as adults and students, but you did want to have that mix. Yeah. Okay. Any other good things we saw? I know I liked the music. I think the music really made a big difference. And that was something I really noticed in editing when I would see the video without the music. And then I'd see it with the music, and it's so much better, let me tell you. Anything to say about good, Lorena?
I agree. I also think the editing really helps with the production and quality of the video, because I know that, without the editing, it wouldn't have been as interesting, or like you can tell that it helped it informationally and also just in the quality of it.
Yes, and very educational, yes. I am proud. I did forget how much information that we had in that video. I have not seen it in the longest time. I think we released it February of 2020. Is that right? So it's been a while, for sure.
2021.
Just kidding, 2021. But that's still a long time. Yeah. But yeah, okay. Any areas of improvement we had, and do not be afraid to really criticize our video.
Well, I noticed, for one, just after watching it, that sometimes we would say school-based health centers and sometimes we would say student-based health centers. And that was something that was unclear when we were presenting and making sure that everyone understood the script. So that's something to watch out for.
Oh yes, that's very true. I think that was that was my fault in writing the script, because I wrote the script for everyone, but I don't know, I just whatever. But yeah, I had forgotten that that was a big problem whenever we were filming. Yes, I really like that idea, for sure, that to have students walking around. Yeah, the health centers. We really wanted to get pictures of students in the centers, but of course that's hard, because HIPAA, and you want to be private when you go to a health center. But yeah, I think that would be good. And now that COVID's over, that is definitely something that's a lot more feasible in making videos now. Yeah, so we do have a few things that we thought, Luden and I, just as we were brainstorming, like I said, the music we thought was good. Information, lots of points of views, reached a lot of people. But then of course, a big thing was the length. Because there was a lot of information, it felt like it was really long. And if you're seeing that video on Instagram, you might just want to scroll right past. It's kind of a video you go for a lot of information, not one that you just kind of come upon. But yeah. Do you want to say anything about it, Lorena?
No, I agree with what we put down there.
Mm-hmm. Yeah. Okay. Next. Okay, so now we're gonna kind of go through the best methods to successfully promote SBHCs using social media. Let me check the time. Oh man, is it 1 already? Oh wait, our presentation ends at 1:30. Okay, never mind. We still have 30 minutes, right? Okay, sorry, I freaked out a little bit. Okay. Okay, so some things so if you yourself wanted to make a post on social media, these were kind of the things that we wanted to highlight based on our experience making a video to reach out to students. And so something that you kind of want to ask yourself, is this your first post? Are you already doing some promotion and outreach? And that's kind of, if you are in a business or you're in a club and you want to create a social media for it, you want that first post to kind of be about your club and what your goals are. And so just doing some promotion and outreach in the first few posts is really essential because that's what a lot of people are going to look for when they want details about your club.
Also, you want to think about who your audience is. Who are you trying to reach? And then making sure that you tailor your video or presentation to those specific demographics. So for us, we were trying to reach middle school and high school students and their families. So we made sure to tailor our videos for those specific people.
And then something else when you're posting, to be in mind of events or mental or health awareness months and weeks and stuff like that. And so we released our video, like we said, in February 2021. And actually February is school-based health center awareness month. And so that worked out perfectly for us. And so just those kind of things. And that's something that we do with Pause a lot of our social media is we'll release posts for Black History Month, and we'll release posts in the week of Suicide Prevention Week and all these types of things, just to kind of stay relevant.
So obviously the point of our video was to make sure that people knew about school-based health centers, but also it's important that you have just general information. And we wanted to make sure that they were able to access them. So we included locations and hours. And you might have seen in the slides, but there is actually a new one opening up as we were making the presentation. So it was just really important that we included updated information.
And another thing about the updated information that I had kind of forgot about until we had watched the video again, is that in our video, when it came out or when we were making it, the vaccine was not a thing yet. So we didn't mention anything about getting vaccinated for COVID-19. So I think that would definitely be something we would want to mention in a future video and some more stuff about that. We also want to identify people or experts to help us with promotion. And so you kind of want to ask yourself as a student, what kind of Instagrams do I look at? Do I look at the official school Instagram, or am I more drawn to the student-led Instagram? And so those are the kind of things you want to think about when you're targeting students specifically.
So we also wanted to include some of the key benefits of school-based health center. So we showed people why it was relevant right now and what it was actually going to do for them, why it's important that they're watching this right now. And then we also made sure to include that services were mostly free. So that's something that a lot of people are going to need is free services. And it's just going to make them more accessible. And we also included how it was confidential.
One thing, consider contests or referrals. So if you'll notice at the end of our videos, like school-based health center challenge, share this with your friends. And so students really like having something to do. You know, when you watch a video, you get inspired, you want to do something. So that's, you know, something to get students to share the video. Also, contests really work. I remember our school-based health center for a little bit, if you got tested for STIs, you got a gift card to Subway. You got like a $5 gift card to Subway, just for getting tested for STIs. And so that was something that got a lot of students tested for sure.
Yeah. And so again, our video was about school-based health centers, but we also wanted to advertise just in general wellness and self-care for everyone by using the services that the school-based health centers provide, but also just in their own homes.
Mm-hmm. All right, so when reaching out to people, you want to definitely reach out to lots of different platforms, TikTok, Instagram, whatever the students are using these days. I remember when I was trying to promote the video to more schools than just our own school, I reached out to every single social media from the middle schools and high schools in my district, and just asked them to post their video. And I said, can you just post this on your story, post it. And I think we got a lot of students that way. It was a lot of work, for sure. There were probably some easier ways, but it's just something to think about. And we, as a group for this project, we did not utilize TikTok or Snapchat, just because I think making our video in a way that would work for TikTok was kind of hard, as well as Snapchat. But I think that's definitely something to take into consideration when working on different projects, and to have different types of videos for those different types of platforms. And so there's different ways to interact with each platform. So Instagram, for example, I like using Instagram because it has lots of different things. It has stories. First of all, there's the 15 seconds, but you can also have saved stories. You have your regular posts. You have, I forget what it's called, Instagram video or Instagram TV, which is for longer videos. Then you have Reels. So I think that's a great way just to put all your stuff in there and have lots of different ways to connect.
So again, also thinking about who your audience is and who you want to target, making it relatable and understandable for who's going to be watching it. So like teens are going to listen to teens. So like in our video, we made sure that we had some teen voices in there. And we also included some people who had already gone through the high school experience to reflect back and give some advice about their high school experience and what to expect.
Sorry, go ahead.
We also tried to get some other people to help. We reached out to some administration from other schools, which actually didn't go very well. We didn't get a lot of replies. So we thought it would be better to reach out to the youth and to students who might actually listen to us, and just to get their input.
All right, so how to reach more people. One thing that we actually did not do, but we really should have, and I think this just kind of goes back to the fact that Loden and I, at that time, I was a junior. It was in the middle of the pandemic. I didn't really know much about social media. I'm definitely a lot more knowledgeable now, but I think using hashtags is an absolutely great way to target specific groups of people who are going to be looking and wanting to watch your video. Also tagging more successful accounts, because oftentimes when you tag another account that's more successful, they're going to post whatever you tag them in. And since they're more successful, that's just more people you're reaching.
So one of the social media platforms that we didn't utilize that we probably should have was TikTok. And that's something that it always has things that are trending, always has things that are more responsive than others. So it's important to do research and figure out what's trending and what's reaching people more, and trying to keep it relevant and being creative and making it exciting.
And so one thing that is just a great tip in general is to reach out to university students in film, because they are willing to help, and oftentimes they need volunteer hours and they won't require any pay, and they do have experience because they're taking these classes. And honestly, working with young adults is more fun. With college students is more fun than adults. They also can help you out a little bit more, especially if you're trying to target students, because they were students not too long ago. Something that's really interesting about New Mexico is we actually have a large film industry. So like Stranger Things was filmed in Albuquerque, and Breaking Bad and a bunch of stuff like that. So we had a lot of people who were really interested in filming and were willing to help us out. Okay, so now we're going to do our activity. If everyone could download the Goose Chase app on their phone. Let me get the code real quick. I think, there we go. There's the code. And I'm actually going to stop sharing my screen. Okay, cool. Let me know if you guys have any questions. Yes, thank you. How are we doing? Is it working?
I'm downloading it now.
Okay, cool. Yeah. I have never led a goose chase game. I've participated in them, but we'll have to see. I think it should be pretty easy.
So we weren't sure how many people we were gonna have, so we went ahead and created a bunch of teams. But I don't think we're gonna need that many teams, Liliana.
No.
Take away a few.
So I think we'll assign people to teams, but so I think we will be in teams. I think we'll be in teams of 2. Yeah, two will work perfectly. And there's actually prizes. We were able to get gift cards for the winning team. So some incentive to try. Okay. Okay, so let's go ahead and do, so I'm just gonna type in the chat which teams you guys are. Is everyone, does everyone have the app? Is anyone having any trouble? Marisa, were you able to get the app? Oh, I can't hear you.
Maybe put your little microphone on your headset down.
Oh yeah.
Can you hear me now?
Yes.
Okay, so I'm in the process of signing up right now.
Okay, cool. And everyone else, it seems like got it. Okay. I'm just assigning people randomly. Wait, did someone leave? Because I thought we had a.
I think someone did leave.
Oh, man, that's okay.
We can do a team of 2 and a team of 3.
Okay. Oh, am I only sending them direct messages? Oh.
No, it's all good. I'm happy to be the messenger.
I didn't even realize.
No worries.
Okay. Okay. And I think once you guys sorry, I'm just once you guys get okay. So it should be a screen like this waiting to start whenever you guys are fully in. Yeah. Is anyone still having trouble getting to that part? Yeah. Marisa, you're there? No, okay. Give a second. So basically, I guess I should explain how Goose Chase works. So there's a bunch of missions that we want you to do. And basically we want you to, in your teams, you want to complete as many missions as you can in 10 minutes. And there's way more missions than you'll probably be able to complete. We just want to make sure that there is enough for everyone. And they're basically finding elements on social media. So for example, one of them would be find a post with a hashtag on Instagram. And you just want to take a screenshot or a screen recording of the element that you find. So yeah. Are we doing good? Are we in?
Sorry, I think it's just not working for me.
No. I think we can go ahead and get started and just wait. Is that okay, Marisa? Okay. Oh, sorry. Okay. Just so that you guys can start working on your mission. So I'm gonna go ahead and start. And it looks like it has started. Is everyone in? Everyone, if you push refresh, you should be able to see the missions. And feel free to ask any questions. Also, some of the missions do have higher points than others. If you wanna, just so you guys know.
So I don't know if there's a way, but like when yeah, okay, Audrey's saying it won't upload screenshots. I like can only take the picture from my camera roll.
Okay.
So if it's like we find one, like a TikTok, for example, I don't know how to take a picture of my phone.
Okay. For that, let's see. What do you think, Clarina?
If you're able to screen record just like a 2-second video maybe of what it is and then submit that, I think it saves to your camera roll. No?
No, because what happens is you can't access your camera roll on the app. You have to like take directly from the phone.
Oh, gotcha.
So I would say, yeah, let's see. I don't know. Which I don't know how to solve that. Let's see.
If you'll have your computers, maybe go
Yeah,
online
if you have
and
some
take
on
a
your
picture of
computers.
that.
Also, I'm gonna trust that you guys do it. If you want to just take a picture of like a thumbs up of you guys, and I'm just gonna trust you guys that you guys did it. Because I don't know how to tell us to do that. So yeah. Does that work for everyone? Just a random picture.
Yep.
Okay.
This is like Be Real. Audrey, you mentioned that earlier.
Yeah, I really want to get into the Be Real, but I don't have a cool enough life.
Oh, me neither. No, my friends got really into it over 4th of July weekend and we're having a lot of fun with it. And I was like,
oh man. All right, about 5 more minutes, guys, and then I'm gonna shut it down. Well, I know we can start grading the submissions. So I think it says on your guys' on the app, but just so you guys know, team 1 is winning by about 200 points. Okay, about 1 more minute, guys.
Remember, this is for a gift card.
And time's up. All right, so I just stopped the game. So yes, congratulations, everyone. Something I really like about this app is you can actually, if you go to your feed, you can see what everyone submitted. And some of them, obviously, I get were kind of hard to find, but I think it's really great. Do we have any comments or anything? I think you guys all did great.
This is a cool app. I really like this.
Isn't it? It's low-key really expensive.
Oh no.
I think for us, we were able to get it free. We just pretended we were educators because there's like an educational discount. But like if you want to do a lot with it, it's kind of expensive. But it's really cool.
That's
really
funny.
like it. Yeah, no,
nice job, team 1. Nice job. We'll get you next time.
So yes, team 1 is the winner. Is that what it is? Yes. Wow. Okay. Team 1, great job. Just curious, did anyone, I think there was 1000.1 and that was to find our video. Did anyone find it? Just curious. No, that's okay.
Not.
It's okay. It's an old video, so that's probably why. But okay, well, I think you guys did a great job. See, I think is that all we have, Lorena? Yeah. Okay. Yes. Oh, actually, the winners of Team 1, can you put your emails in the chat, and so I can get you guys your gift cards. Awesome. Yes, of course.